Hey guys, welcome back to the Reinhardt's Rundown. Today we're focusing on things that cause digoxin toxicity. Last time we talked about one of the most common things we see contributing to dig toxicity, electrolyte imbalance, specifically imbalances in potassium, magnesium, and calcium. We'll drop a link below if you want to check that out. Now, we know which electrolytes can increase the risk of dig toxicity, but who is likely to experience those symptoms? That's just as important. Imagine Betty. I'm making Betty up, but we all know Betty. Betty is the perfect storm for dig toxicity just waiting to happen. Betty has all the risk factors. Number 1, poor renal function. Dig is mostly renally cleared, so if a patient's kidneys aren't working, they'll likely need a dose reduction in their dig, or it's going to accumulate in the bloodstream. When we talk about specifics, if the creatinine clearance is less than 50 milliliters per minute, let's go ahead and reduce that dose or change the frequency before starting a dig regimen. In advanced kidney disease, we might even hold the digoxin. Number 2, patients who are on diuretics. Remember, electrolyte imbalances are a big factor here, so anyone on diuretics needs to have those electrolytes checked. Number 3, patients who are on other drugs that interact with digoxin, like amiodarone or other meds that are metabolized through PGP or CYP3A4. Number 4, patients who are female. Number 5, patients who are small and frail with low or lean body mass. Number 6, patients who are elderly, especially greater than 70 years. Number 7, patients who are Betty. But seriously, Betty is a tiny, frail, elderly female, and she's on a lot of medications, probably a diuretic and other meds that impact heart rate, and other meds probably that interact with the same enzyme as digoxin, and she probably has some sort of or some magnitude of kidney dysfunction. So yes, Betty is a walking, waiting digoxin toxicity case. So when you're trying to remember dig toxicity risk, think of Betty. Think of Betty and dose reduce. We probably want to do 125 micrograms or even dose that every other day. That's the Reinhardt's Rundown.